Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com is Mono An Std, mononucleosis. Mono is not strictly a sexually transmitted disease, but it can be transmitted through sexual contact. Popularly known as the kissing disease, mono can also be spread through saliva, sharing utensils, and other forms of close contact. /r/n/r/n mononucleosis is highly contagious and is often caused by a herpes virus known as the EpsteinBarr virus, EBV. /r/n/r/nsd Productions Getty ImagesrnrnIf If you have mono and you experience sudden pain in the upper left side of your abdomen, call 911 or seek emergency care right away. This could be a sign of a ruptured spleen, a rare but serious complication of mononucleosis. /r/n/r/n Mononucleosis is a very common infectious disease usually caused by the Epstein-Barr virus, EBV. Most Americans have been infected with it by the age of 30. It mainly affects teenagers and young adults, but children can also contract it. For most people, mono isn't very serious and will improve over time with proper treatments. /r/n/r/n Mono symptoms can include /r/n/r/n These symptoms can disrupt your daily life, making it difficult to focus on school or work. Generally, mono goes away after 2 to 4 weeks. For some, the fatigue may last longer, up to 6 months after getting sick. /r/n/r/nEBV, the virus that causes most cases of mono, is a kind of herpes virus. However, it is different from HSV, which causes oral and genital herpes, though both can be transmitted through sexual contact. /r/n/r/n Mono is very contagious. Between 80% and 90% of mono cases are the result of EBV. The virus stays in its inactive form in your body even after you recover. Most likely, people will only develop mono once. If EBV reactivates, it usually doesn't cause additional symptoms. That being said, you could potentially spread it to others, and people with compromised immune systems may develop symptoms more than once in their lifetime. /r/n/r/n Beyond EBV. Other viruses that can cause mono or mono-like symptoms include /r/n/r/n When it spreads through sexual contact, mono could be considered an STD. However, that is not the only way it spreads. /r/n/r/n Mono is transmitted through infected body fluids, including genital secretions, but you can also get it from contact with blood or saliva. /r/n/r/n A common way of transmitting mono is by sharing drinks or eating utensils. Condomless sex and kissing are also easy ways to spread mono. /r/n/r/n You can also get mono through blood transfusions and organ transplants. Being in close proximity to an infected person who is sneezing or coughing can also transmit the virus. /r/n/r/n The common recommendation to avoid or stop the spread of mono is simple. Avoid kissing, sharing drinks and utensils, and having sex without condoms with people who have mono or are showing symptoms of the illness. If you are experiencing any of the symptoms yourself, refrain from engaging in these activities until your symptoms have cleared. /r/n/r/n Teenagers between the ages of 15 and 17 are at highest risk for getting mono. This group is also more likely to have severe symptoms. Younger children and older adults can also get mono, but their symptoms tend to be milder. /r/n/r/n When you have had mono, the virus remains in your body but becomes inactive. Although some research suggests that it may be possible for mono to recur, this is considered very unlikely. /r/n/r/n There is no vaccine for mono, and mono is not curable. It will, however, go away on its own. Treatment revolves around doing what you can to alleviate and manage your symptoms. These include /r/n/r/n. You should also avoid contact sports that could potentially cause your spleen to rupture. /r/n/r/n. Healthcare providers may also recommend that you avoid penicillin antibiotics, such as amoxicillin, if you have mononucleosis. /r/n/r/n. If you have symptoms of mono, it is important to see a healthcare provider. Getting a diagnosis can help you avoid spreading the virus to other people. /r/n/r/n. To diagnose mono, your medical provider will assess your symptoms and check for swollen lymph nodes in your neck. They can usually determine when someone has mono by symptoms alone. You may need blood tests if you don't have a typical case of mono. /r/n/r/n. If your symptoms haven't improved after 2 weeks or they get worse, make another appointment with your provider. /r/n/r/n. Mononucleosis can be spread through sexual contact, but it is not strictly a sexually transmitted infection. Mononucleosis is spread through body fluids, which may include genital secretions, but it is more common to get it from contact with infected saliva. /r/n/r/n. Mononucleosis is extremely contagious. Most people will be exposed before the age of 30, but teenagers are more likely to experience severe symptoms than children and older adults. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.